So why would you want to do dental sleep medicine? Why would you get involved? Why would you be interested? What significance would it have? Why does everybody and their dog have a course? And why do you get the impression that you should learn about it, because otherwise you'll be the only one that doesn't know about it? And the reasons are multifactorial, of course. They're based on a number of different premises. The first one, of course, is that this is an area of care, medical care, or care that at least has a medical interface, which we want to bring to our patients. Just as we ask them to refrain from smoking, just as we advise them that excessive alcohol consumption is not a good idea, just like we ask them not to put betel nut in their cheeks. The list goes on of things that are expected of us or of our teams in the promotion of good health. Obstructive sleep apnea, as an example of dental sleep medicine, is a biggie. We're expected to provide screening for oral and mouth cancer, and no one would criticize that, but more of our patients are going to die from obstructive sleep apnea than oral cancer. So it doesn't question if we should be using the screening tools and examination for oral and mouth cancers, but what it does do is it does ask us why on earth we're not screening every single patient that comes through for sleep disordered breathing. So that's the first thing. The second thing is, by default, the airway goes through our territory. We are responsible for the lips, the tongue, the palate, the pathologies thereof. We're very, very intimately related to the teeth and the jaw joints, and therefore the jaws. It just happens that the airway goes through all our stuff, and so consequently we can't just ignore it. We can't just take a step to the side and say, well, we'll leave that up to somebody else, because it's our responsibility. And following on from that, there is a standard of care that's expected in each of these areas. So if we don't take an x-ray picture of a tooth to show when we suspect a tooth as having either become non-vital or we suspect that there is something amiss, it's a standard of care to take an x-ray to see if there is a periapical radiolucency there. Yes, I mean, there are other reasons, or there are other tests to do as well, but nonetheless, these all make up the standard of care. And if we don't fulfill or achieve that standard of care, we're remiss, and we're being seen to be remiss. So in an area where, and I hate to say this, but in an area where suddenly there's a lot of interest, and suddenly everybody's raising the bar a bit, it probably behooves us to be a little bit more aware of that standard of care creeping in. And I think it's a good thing, but to not get involved may open us, make us more vulnerable to questions about the standard of care that we're providing, and the legal ramifications of that. And then, although there are many reasons, the third reason I would suggest is that this has an intimate relationship to what we do every day. So whether we're putting implants in, whether we're doing restorative work in putting onlays or veneers or whatever it is that we're doing, this has impact. It has impact through bruxism. It has impact when it comes to TMD. The effect that it has on developmental issues too. So when we see children, and children become adolescents, and adolescents become adults, obstructive sleep apnea, airway issues, and that sort of thing that goes under the umbrella of dental sleep medicine have impact as to how that individual is developing. And when they've got wherever they've got, it also has a bidirectional relationship with either exacerbating or maintaining that particular pathology. So, in a nutshell, There's three very good reasons for doing this. Number one is because we'll be providing a better level of medical care, quality of life, disease prevention. That's number one. That's important. Number two is from a medical legal standpoint and a regulatory body or department standpoint, this is rapidly becoming a standard of care. And if we don't fulfill that standard of care, we're leaving ourselves vulnerable again. The third thing is that this happens to be what we do. And just like ignoring endodontics, which we couldn't do, or ignoring perio, which we shouldn't do, we can't ignore this. It has too much influence on what we do every day, whether it be tooth wear, jaw joint problems, TMD, facial pain, longevity of restorations, in its full in the full picture. So those are three good reasons, and there are probably many more, but those are the three that make this all worthwhile. So that's just a starter. You can think of your own, I'm sure, but those three issues, that is the fact that this is rapidly becoming a standard of care, that means that it's something we do every day, and it's very beneficial to the patient, are probably three reasons enough.